When I was in school, I had a wound care book that said, don't treat the hole in the patient, treat the whole patient. I got thinking about that. Well, why should wound care patients be treated like that but nobody else? That's the difference between a system and trying to just throw something at your health and try to improve it. Some people will look at doing one thing some of the time and expect like some amazing result, but you're not going to get it that way. It's many things most of the time. Notice I said most of the time. You don't have to be perfect, but if you want a difference in your health, you have to do something differently. You have to apply these basics correctly most of the time. Look at it this way. You can't exercise your way out of a poor diet, but people try to do it all the time. I know I eat junk, but I'm going to go to the gym. It doesn't work that way. That's the American way. We want it to work that way, but it doesn't work that way. So you're not going to sleep your way out of not enough exercise, and you're not going to exercise your way out of a poor diet, and you're not going to eat yourself out of dysfunctional relationships. People want affordable health care. The stuff we're going to talk about today is affordable health care because most of the factors within the system are free. So it doesn't get more affordable than that. People say to me all the time, well, I can't afford organic food, Dr. Sam. That's expensive. No, a new liver is expensive. A new liver is like 40 grand, $40,000, and that's probably on the low end on the stolen market. They call it the black market, right? Of liver that's been stolen, right? At least in America, about $40,000. So the cost of health is always less than the cost of sickness. Always, I've compared this every way from straight out money to emotional, physical, spiritual costs that you're going to endure. The cost of health is way less than the cost of sickness. And your health needs to be a priority in your life because people can afford whatever is a priority. But put things in perspective. And health should be number one because I'm going to tell you, I've met a lot of wealthy people in my life and they're no exception to the rule. When they're not healthy, they're miserable. So what good is all that money? It's not. They're miserable because they're in pain all the time or they're sick. And so all that money means nothing. When you have good health, you have true wealth. There's no doubt about that.